Why is clinical trial participation so important in small cell lung cancer, and what advice do you have for patients considering one?
So clinical trials are very important, not only in small cell lung cancer, but at all cancers. The only way that we know how to treat this is by doing clinical trials. That is what moves the needle forward. It's thanks to patients that participate in clinical trials that we know whether something worked or how much worked or something did not work, and we need to either get back to the drawing board or eliminate that possibility and move on. Unfortunately, only the minority of patients participate in clinical trials, and that is many times only because of access. So it's important for patients to consider clinical trials. That is where we're analyzing the future medications, and many of those future medications will become the standard of care. And by participating in clinical trials, patients will have access to those medications. And by participating in clinical trials, patients are also paying it forward. These clinical trials may not help them as much as possible, but they are helping those patients that down down the line. When patients are considering clinical trial, there's many questions that they need to ask. Is what does that involve for me? How frequently do I need to come to the cancer center? Aside from getting it, what else is asked for me? Am I being asked to also come to other blood draws, for example, or am I just receiving this treatment and it's that's treatment by itself? Is there a randomized component to this clinical trial? Am I being elected to receive one arm or the other? Is there a placebo component in that trial? The majority of patients with the majority of trials in cancer are not placebo based, but that's important to know. What help can the clinical trial give me? Again, like we talked about, many clinical trials do have a can help patients with lodging or transportation. So the activation tip for that is if you're considering a clinical trial, to make sure you read that consent, and that consent can be difficult sometimes. So if you have questions, just ask. And when patients are in clinical trials, there's a whole team of people that are looking for that patient. So ask that the questions that you may have from that consent with that patient, and I always encourage a clinical trial because again, that is what is helping us move the needle forward.